Hi everyone, my name is Michelle. This is my channel where I document my journey with stage 4 triple negative breast cancer, adrenal insufficiency, and anything else I find interesting. So here's my update. I'm in the hospital. I've been in the hospital since about 4 a.m. last Monday morning. It is now about 11 p.m. on Sunday evening. It started with a sore spot, like a small bump on my abdomen. I don't know how it kind of started. It may have been a scratch or something, but while my immune system was kind of down for the count from chemo, it turned into a larger area of irritation, and then it became quite painful. It morphed into an irregular shape. It got a red kind of, first I tried to use what I normally would do on like an ingrown hair or pimple or something. I used castor oil on it. I tried some antibiotic lotion that I had, and none of that really worked. It continued to get worse. Then it got a kind of a red area around it, and so I figured, okay, it's time to call the dermatologist. I still was thinking it was like an ingrown hair or a hidradenitis, but it was Sunday night, so I figured, well, wait till Monday morning and call the dermatologist. But at about 2:30 in the morning, I woke up feeling like I had a fever. I had the chills. I couldn't get warm. And that is the one symptom that they always kind of drill into you at chemo, that if you have that, you should always call right away, 24/7. So even though my thermometer said my temperature was normal, I called the oncology center. The on-call doctor said to go right away to the emergency department. It wasn't like an ambulance ride, but to go now. So headed to the ER. Before I left the house, I took 60 milligrams of hydrocortisone, which I felt was an appropriate stress dose. It's triple my morning dose. So the oncologist had called ahead. So when I got there, they were expecting me. I didn't even see the waiting room. They took me right to triage, and their thermometer showed I had a fever of 100.3. So they took me right in the back. They drew a bunch of blood for some cultures. They got me started on an IV fluid and broad spectrum antibiotics. And then they gave me an injection to complete the medical emergency stress dose for steroids. So typically that stress dose is 100 milligrams. So because I had taken 60 orally, they gave me an injection for 40 milligrams of hydrocortisone. That was to complete the 100 milligrams. So they admitted me to wait for a bed upstairs, which I got settled into about 5:30 Monday evening. I have a bunch of funny stories about the last 7 days, and I'll make different videos or, write about them or something. Definitely have some good stories. But the long story short is that I had 1 dose of one antibiotic and 5 doses of a second antibiotic, which happened kind of every few hours over an infusion until Tuesday morning. And then they switched to a third antibiotic, which was they switched. So we did 1 dose of one, 5 doses of a second, and then we switched to a third antibiotic every 8 hours between Tuesday and Thursday morning. Now, from the ED admission labs to Tuesday's labs, the white blood cells came down a little bit. But then between Tuesday to Wednesday, they stayed the same. And Wednesday to Thursday, the white blood cell count actually started to come back up, which meant that maybe the infection was worsening, and whatever that third antibiotic was not the right one. So what we did was on Thursday, we switched to a 4th antibiotic, which was in the same class as the 3rd one, but covered a little bit more stuff. The white blood cells continued to rise. So then they added another antibiotic to that. So now I'm on 2 different antibiotics, the 4th one and a 5th one. And it covers more types of organisms, like anaerobic bacteria. I can get the phone to stay still. This will work. So between Thursday and Friday, it went up again. Friday night was my first, when they added the second antibiotic into the regimen, the flagyl. And then Friday to Saturday, it still went up, but I had only had the one dose of flagyl. So we continued that another day. And then this morning, which is Sunday, finally the white blood cells are coming down. So that's good. The area looks a lot less angry. The redness has receded. The hard kind of spot in the center that was originally the bump and then turned into this kind of irregularly shaped area that was really painful seems to be getting smaller again. So everything's heading in the right direction clinically, and now the labs are also starting to look a little better. So we'll see tomorrow. If the white blood cells come back down again, then there's a chance that I can go home tomorrow. But there's also a chance that they might decide to switch me to oral antibiotics first, because I'm on IV, everything's going through my port. So they might switch me to oral antibiotics first and keep me in the hospital just to observe and run the labs again to make sure that it continues to trend down on whatever they decide to send me home, because the blood cultures haven't really showed anything that informs an antibiotic decision. They did an ultrasound and there wasn't enough of a pocket of fluid for them to do any kind of a culture on whatever's in this thing, and it's very self-contained. The ultrasound shows that it's really just kind of between the layers of skin and fat in the abdomen. It's not infiltrated the system or the abdominal wall. So if they go poking at it, they run the risk of actually making a bigger problem. So they're not inclined to do that. So it's really just kind of trying different antibiotics until they find what works. When you're in cancer treatment, oftentimes if you get an infection because your immune system is compromised, that could be the thing that is really dangerous more than the cancer, as far as an immediate threat to your life. I've had incredibly awesome nurses and doctors here. I've been really impressed. They've all been at least familiar with adrenal insufficiency, and the nurses especially have been really keenly aware of how serious it is if I do not get steroids on time, and if I ask for extra steroid, or if I ask for them early, if I'm telling them I am having symptoms of low cortisol. They've all kind of really responded to that. On Tuesday, I needed it like 2 hours early. It was like I started to kind of feel lightheaded and have abdominal cramping, and I'm like, these are my symptoms of low cortisol. And she's like, okay, I'm going to get you your steroids early and we're going to take care of it. And I did. I felt better immediately. And then 2 days later on Thursday, yes, this is my book, keeping track of all of the meds, which doesn't have enough room in it to keep track of meds during a hospital stay. So I'm writing really tiny. But on Thursday, that happened again. And it was really scary, actually. I really kind of felt like crisis-like coming on. Like I couldn't form the words I wanted to say. It was, I was lightheaded and I got dizzy and I got nauseous, and it was, the nurses responded immediately, like, give me 5 minutes. And they went and they texted the doctor, like, she needs an injection now. And they did get that one dose in me, which was my regular dose because it was due anyway, but it wasn't enough. I still kind of felt funky. So I messaged my endocrinologist, who called me back in like 2 hours, even though she wasn't in the office that day, and talked to me. And she got involved in the conversation. She talked to the doctor here, and they gave me a stress dose of another 100 milligrams at that time. And so, which is also could have affected the white blood cell count going up. And so this is all like a really kind of a dance with all of the things going on. So anyway, I just kind of want to give a shout out, extra special thanks to my nurses, Dell, Jordan, Ashley, Ikram, Jen and her student Francesca, Zara and her SHU student whose name I can't remember, Olivia, Shavanti, the nurse manager Carly, everybody, West Tower 10, Bridgeport Hospital, you guys are rock stars. The doctors also have been very responsive. They've communicated very well with each other. We've got the hospitalists on the floor that are taking care of all the patients here and seeing me on a daily basis and examining me several times a day. There's the surgical team that's been in several times a day. The infectious disease, and of course my oncology team. So lots of doctors involved, even that's all since I've been from the ER. I was moved into this private room at 4:30 a.m. this morning. I had been in a room with a second bed added for overflow. I was in the second bed. So I had a roommate. She was lovely. We enjoyed each other's company. She went home today, and I wish you well, my new friend Judith, and your wonderful family. But I couldn't find any quiet time. I wasn't going to make a video like this in a public room. I was right next to the nurse's station. There was a lot of noise all the time. And so that was what has kept me from giving this update. So that's my update. Maybe I'll go home tomorrow. If not, it's okay. If I don't go home tomorrow, it's because they need to make sure that I don't come back, and that's okay. So everybody have a great day. Have a good, the weekend's over, so have a good week, and I will update you soon.